Hello, it's wonderful to see everyone here today. Such a huge number of registrations for the session. So thank you very much for joining us. It's the launch of our new report, The State of Gender Equality in Victoria's Public Sector 2026, Progress, Persistence and Priorities under the Gender Equality Act. I'm Dr. Niki Vincent. I'm the Public Sector Gender Equality Commissioner, and I want to acknowledge the traditional owners of the land on which we meet today. The Wurundjeri people of the Kulin Nation is where I am from, but from all of the places where you are, I pay my respect to elders past and present and extend that respect to emerging leaders and any other First Nations people who are here with us today. Before I begin, just a few housekeeping notes. We will have time for questions at the end of the presentation. So if you'd like to ask one, please put your question in the chat. There's such a huge group. We've had 500 registrations. It'll be too hard for us to manage people putting their hands up. So if you can put your question in the chat, our team will do their best to collate the questions at the end. The session's being recorded and it will be distributed afterwards. Okay, so 5 years ago, Victoria implemented the Gender Equality Act, and it's one of the most ambitious pieces of gender equality legislation in Australia, built on the expectation that the public sector should lead by example in tackling systemic inequality. It moves beyond aspiration and into accountability. So rather than relying on voluntary action, the Act places positive duties on around 300 public sector organisations, including the VPS departments, but all local councils, public sector bodies, universities and statutory authorities. It covers a workforce now of more than 500,000 people, and it supports a stronger public sector that can deliver high quality services and support to the Victorian community. Public sector workers are our nurses, our train drivers, our teachers, our firefighters and our community support workers. And when public sector workers have fair pay, opportunities to contribute and progress regardless of their gender, and are safe from workplace sexual harassment, they can do their best work. And when they do their best work, Victoria benefits. I also want to pause for a moment to acknowledge the people across Victoria's public sector who've been carrying this work forward. Many of you are here today. I've met many of you in person. You've collected and analysed data, listened to employees, developed action plans, reviewed systems and translated the Act into practical work inside complex organisations. And I want to recognise that expertise and your persistence. So thank you. Victoria's now got 5 years of comprehensive sector-wide data on gender equality, which allowed us to track progress over time across the sector. Today, I'll take you through what the data tells us across the 7 key workplace gender equality indicators, where progress is taking hold and where inequality remains persistent and where efforts will make the biggest difference. So let's begin with the composition of the workforce. So next slide, please. So this first indicator is gender composition of the workforce. So next slide. Women made up 66.1% of the public sector workforce in 2025. Women held 57.3% of senior leadership roles in 2025, and that was up from 53.1% in 2023. 4 of the 11 public sector industries reached proportional representation of women in senior leadership, up from only 2 in 2023. So that's a good amount of progress. These industries that now have proportional representation are community and cultural services, and other industries category, universities and water and land management. Nevertheless, women remain underrepresented in leadership in 6 industries. In finance and insurance, women are 63% of the workforce, but only 52% of senior leaders, still up 7 percentage points since 2023. And in police and emergency services, women were 38% of the workforce, but only 27% of senior leaders. Sorry, it wasn't up 7% in finance and insurance, it's up 0.7%. And in emergency services, senior leadership is up 0.9%, so not quite 1%. When we talk about workforce composition, we also look at the gender representation in part-time roles, and we saw encouraging movement in part-time work. The proportion of men working part-time increased from 26.1% to 27.9%, while the proportion of women working part-time fell slightly from 54.8 to 54.1%. So that narrowed the gender gap in part-time work by 2.5 percentage points. Next slide, please. So what can organisations and sector leaders learn from these results? Well, it starts with really understanding your own organisation's data. Where are women and men concentrated? In women-concentrated organisations, hiring more women is not necessarily a sign of progress, and that's something we're still seeing in progress reports. With organisations saying, well, we've become more women concentrated. That's not necessarily a sign of progress. In men concentrated occupations and industries, workplaces need to be safe and welcoming for women. Part-time and flexible work also matter. Men should be genuinely encouraged to use these arrangements, and people working part-time or flexibly should also have equal access to development and progression. So those things shouldn't hold back people's career. These aren't easy shifts, but they're also not beyond our influence. The goal is greater gender balance across roles, industries, and level of seniority. Next slide, please. So indicator 2 is the gender composition of governing bodies, and that's where we've got the clearest results around sustained progress. So the next slide, that's up, thank you. In 2025, women made up 53.9% of governing body members and 51.1% of governing body chairs. Those results have remained broadly stable across the 3 reporting years, so 21, 23 and 25, and they sit within the Commission's 45-45-10 framework for gender balance. You can find out more about that in the report, or we can talk about that in the question time. So this shows the impact of the Victorian Government's Women on Boards commitment 10 years ago, which requires that women make up at least 50% of all new appointments to courts and paid government boards. At the industry level, the results are also really strong. So 10 of the 11 industries in the public sector had governing bodies that were gender balanced or had a higher share of women. It's important to note that while equal representation of genders on board should be the ultimate goal, a slight overrepresentation of women has to be viewed in context. In women-concentrated industries, having a board that is closer to the gender composition of that industry is acceptable in the wider context of persistent gender inequality. In men-concentrated industries, increasing women's representation on boards can be part of a legitimate strategy to help drive broader organisational change. So these results are an important achievement, but there is one clear exception, and that is local government. That's the only industry where women were underrepresented on governing bodies. Women's representation among councillors fell from 45.6% in 2021 to 44.2% in 2025. 8 councils had only 1 women councillor and 15 councils had only 2. A local government, as I'm sure you know, is different because councillors are elected rather than appointed, but that doesn't make the result less significant. Councillors govern many of the services closest to people's daily lives, and the evidence points to continuing barriers for women who stand for and serve on councils. Next slide, please. So expectations, strong results across most of the sector shouldn't lead to complacency. Governing body composition needs to be monitored, and organisations should act where any imbalance emerges. Where duty holders influence appointments, gender should be considered alongside other forms of diversity. And where appointments are made externally, for example by the minister or the department, organisations can still do something I see a lot in progress reports and in gender equality action plans where organisations are saying we don't have any control over that. Actually, organisations can still advocate for balanced and diverse representation. You can write to the department, you can write to the minister. Local government requires particular attention. The barriers aren't only about encouraging more women to stand for election, they also include council structures and schedules that can be difficult to combine with caring responsibilities, as well as gender-based bullying, harassment and abuse directed at women candidates and councillors. Councils and peak bodies have already done important work in this area, but the next step is to understand how those barriers appear in each local context and take targeted action to address them. And that should be part of every council's gender equality action plan. Next slide, please. Indicator 3 is gender pay gaps. And gender pay gaps are one of the most commonly cited measures of gender inequality, and I'm sure you're all familiar with them. They matter because they weaken women's financial security across their lifetimes and they hold back productivity and economic growth. There's a puzzle in this year's data that I want to flag before we look at the numbers. Many individual organisations reduced their pay gaps and the pay gaps narrowed in most industries, yet the gap across the sector as a whole barely moved. I think we've got the next slide up now. So the mean total remuneration pay gap sits at 15.7% at the sector level. It hasn't narrowed since 2021. The good news is, as I said, that gender pay gaps narrowed within many organisations and across 7 of the sector's 11 industries. Some of the strongest reductions in gender pay gaps occurred in traditionally men-concentrated industries and occupations. So police and emergency services actually reduced their pay gap by 6.1 percentage points, so down from 18.1% in 2021 to 12% in 2025. Water and land management, they had a 2.9% percentage point reduction. Labouring roles, we saw a 9.4 percentage point reduction there, and machinery operators and drivers, a 3.3 percentage point reduction. And then in technicians and trade workers, there was about a 1% reduction. This pattern is consistent with some organisations and industries beginning to address the structural drivers of inequality, including gendered occupational segregation, progression pathways, and access to higher paid roles. As I said, many organisations reduce their pay gaps at the workplace level. 22% of public sector organisations are now within our target total remuneration pay gap range, which we've set at plus or minus 3%. So that's up 4.3 percentage points since 21. So that's good. At the same time, the proportion of organisations with moderate to large pay gaps declined from 25% to 19%. But despite these positive shifts at the organisation and industry level, the pay gap, as I said, hasn't narrowed at the whole of sector level. And I'm sure you're wondering why that is. We've done some deeper analysis and it shows that most organisations that reported in both 21 and 25 actually improved. When we look at just those organisations, the gap reduced by 2.1 percentage points. But organisations that were newly represented in the 2025 data had on average higher gender pay gaps than organisations that were represented in both years. And if you put those organisations into the mix, the increase that comes from those organisations, the newly represented organisations, washes out the improvement among the matched organisations. And workforce positioning also plays a role. So if we look at all organisations, women increased their representation in higher remuneration parts of industries between 21 and 25. However, men also experienced substantial movement and women remained more likely to be positioned in the lower remuneration parts of most industries. Overall, the analysis suggests that the small increase in the reported whole sector pay gap reflects a combination of broader reporting coverage and structural differences in where women and men are positioned across the workforce. So I know that's a lot to take in, but it's important to understand. The bottom line is this: progress is happening, but the structural drivers of the pay gap remain very strong. Next slide, please. Let's have a look at the pay gaps at industry level. As you can see, local government was the only industry within the target pay gap range of plus or minus 3%. Its pay gap reduced from 5.7 in 2021 to 2.4 in 2025. Public healthcare, which has the highest pay gap of any industry, reduced its gap by 5 percentage points from 34% down to 29%, but it's still a whopping pay gap, obviously. And police and emergency services reduced their pay gap by 6.1 percentage points. As I said, from 18% to 12%. So that shows that meaningful change is achievable even where the gaps are widest. Next slide, please. Pay gaps widened for women in leadership. As I said, women's representation in senior leadership rose from 53.1 in 2023 to 57.3 in 2025, a move towards proportional representation because we've got women as 66% of the sector overall. But the senior leadership pay gap increased from 11.2 to 12.5%. That might sound contradictory, but when we looked at the data more closely, it makes sense. So as more women enter senior leadership, they enter in the more junior and therefore lower paid senior leadership roles rather than immediately moving into the highest paid positions. So this isn't necessarily a sign that progress has gone backwards, but it does tell us what we need to watch next. Getting more women into senior leadership is important, and then we need to make sure those women continue to progress into the most senior and highly paid roles. And that's why we need to look at both representation and remuneration. Either one on its own gives us an incomplete picture. We will have more information on the senior leadership pay gap. We're doing some work on a sort of more precise breakdown, and we'll publish that shortly. Traditionally, women-concentrated occupations had the highest pay gaps. Analysis of the gender pay gap at an occupational level revealed the highest occupational pay gaps in 2025 were in community and personal service workers. That pay gap is a whopping 24.1%. That's up 4.1 percentage points since 2021. Sales workers, we have about 1,000 sales workers in our data. We don't know what they do. Obviously, they do sales. It's a mystery to us, but their pay gap is at 20.3%. So it's up 6.4 percentage points since 2021. And for professionals, the pay gap is 16.5%, and that went up again 4.2 percentage points since 2021. The fact that some of the largest gaps sit in traditionally women-concentrated occupations, such as those I've just mentioned, shows how inequality can persist even where women predominate. These pay gaps are driven by structural and organisational factors, not by individual choices, and they require deliberate evidence-based action. Measuring the gap is the starting point. Addressing it's a real test. Next slide, please. So our expectations, what can organisations learn from these results? Well, strong targeted action is needed on gender pay gaps. They build over time through recruitment, promotion, workforce composition, occupational segregation, leave and flexibility, sexual harassment and other forms of discrimination. In every duty holder organisation, they need to be investigated, addressed and ultimately eliminated. And that starts with understanding your own data in detail. Where is the gap sitting? Is it larger in particular occupations, work areas or levels? Are women or men concentrated in particular roles or pay bands? Organisations should review starting salaries and start to look closely at whether bias is shaping your recruitment, promotion or pay decisions, and where discriminatory practices or unconscious bias are embedded in workplace culture, organisational norms. They need to be identified and addressed. The widening senior leadership pay gap is a particular concern. Gaps at the top translate into very large dollar differences, so organisations really need to examine how pay is distributed across the senior roles and top pay bands. And wherever the data allows, I also expect duty holders to apply an intersectional lens so that they can see where inequality is being compounded and who might be experiencing the greatest disadvantage. Some drivers, including occupational and and industrial segregation are structural and they are more difficult to shift, but organisations still need to act on the levers they control, and that includes building pathways into roles and areas where particular genders are underrepresented. Next slide, please. So workplace sexual harassment, I really want to speak frankly about this because there absolutely has to be urgent action to drive down sexual harassment and to improve formal reporting. Workplace sexual harassment continues to cause significant harm to individuals and to organisations and the broader community. This includes long-term impacts, not quite that slide yet, thanks Eileen. This includes long-term impacts on mental health, job satisfaction, retention and productivity. The economic cost to Australian employers was estimated at $3.8 billion in 2018. That's huge. Our data shows that women's and men's experience of sexual harassment barely shifted at the sector level, and for non-binary and gender diverse people, it increased. So we'll have that next slide, please. So you can see that employee experience surveys show that in 2025, sexual harassment was experienced across the sector by 6.4% of women. That's down less than 1 percentage point since 2021. Also, 3.5% of men, also down less than 1 percentage point, and up 4.2 percentage points for non-binary and gender diverse people to 16.9 percentage points. Now, if we extrapolate these rates reported in People Matters surveys out to the whole of the public sector workforce, that would mean that around 21,000 women, almost 6,000 men, and approximately 600 non-binary or gender diverse people experienced at least one experience of workplace sexual harassment in 2025, and that's conservatively. Those numbers are extraordinary. There's also a higher risk for certain groups. So groups that experience intersecting forms of discrimination are at higher risk of sexual harassment. The highest rates of all were experienced by non-binary and gender diverse people, as I've said, but also young women. That experience was 13.9%, down 0.12 percentage points since 2021. First Nations women experienced 7.6%, up 1.12 since 2021, and women with disability 11.7% in 2025, and that's up 0.11 percentage points since 2021. So most of that data is going in the wrong direction. And this is all despite Fair Work, anti-discrimination, occupational health and safety laws that require organisations to take proactive steps to prevent and eliminate sexual harassment. So every organisation must treat it as a workplace hazard, not as a misconduct or complaints issue. It's a work health and safety issue. Next slide, please. At the industry level, sexual harassment experience rates have shifted in different directions since 2021. In 2025, with the industries with the highest sexual harassment experience rates for women were police and emergency services, that's at 11.8, down from 12.1. Transport, at 10.6, down from 13.8. Community and cultural services, 10.2, up from 5.5 in 2021. And for men, the highest rates were in public health care, 6.1%, police and emergency services, 4.7%, and local government, 4.6%. Sexual harassment remains a whole of sector issue, with different industries facing different challenges. However, within an overall picture of insufficient progress, there were some encouraging signs. So if I could have the next slide, please. In the employee experience data, an increased share of people who said they experienced sexual harassment said that they went on to report it formally. In the workforce data, the number of formal reports recorded by organisations also rose for women. And this is likely due to a combination of things, so improved data collection and reporting, as well as the potential increase in actual reports made. Several large metropolitan health services increased their numbers of formal reports of sexual harassment quite substantially. And given the public healthcare industry has among the highest rates of sexual harassment in the public sector, sector, increased ability to monitor and respond to sexual harassment through improved reporting processes and systems is a positive step. But there's still an alarming gap between the people who said that they reported sexual harassment in the People Matters survey data and formal reports in the workforce data. This suggests that in many workplaces, a lot of sexual harassment gets reported to a manager, but is never recorded at the workforce level. And that's a big problem, because if it isn't formally recorded at the workforce data level, then it isn't visible to the executives and board members that are responsible for seeing that it's addressed. It also means there's no oversight of how managers are responding to sexual harassment, whether it's being dealt with in a victim-centric way or, potentially being swept under the carpet. This isn't good enough for such critical work health and safety issue. So closing this reporting gap has to be an absolute priority for public sector organisations. Next slide, please. So as Commissioner, I've made sexual harassment one of my top regulatory priorities. Any instance of sexual harassment is unacceptable. We've talked about the harms that it creates, and I do expect urgent action to drive down the experience and improve the formal reporting. Organisations have to treat it as a workplace hazard. That means applying the same level of care, oversight and due diligence that you'd expect for any other work health and safety risk. Survey data reveals the scale and nature of the problem. Formal reporting data shows whether organisational systems are actually working, whether people are being properly supported, and whether incidents are being addressed. And where there's a persistent gap between what employees say they experience, what they say they report, and what organisations formally record, that's a real governance issue and a work health and safety failure. Prevention and response strategies need to consider who's at heightened risk and how safe different groups feel to speak up. Limited data about groups facing intersecting inequalities is not a reason for inaction. 5 years after the Act came into effect, generic approaches built around training alone are not enough. Duty holders must have targeted, context-specific strategies that measurably reduce sexual harassment and improve reporting. This is challenging work, but it's also absolutely essential work, and better systems will lead to better prevention and response. Next slide, please. So indicator 5, recruitment and promotion. So this looks at whether people have had equitable access to recruitment, development and promotion, and overall there are some encouraging signs. Next slide, please. Promotion rates for women and men were almost identical in 25, suggesting that at an aggregate level, women and men who progressed through recruitment processes were promoted at similar rates. Employees across all genders also reported greater confidence that recruitment processes were fair than they did 4 years ago. But there are two findings that deserve a bit of closer attention. The first is access to development opportunities. Men were considerably more likely than women and gender diverse people to access higher duties, secondments, mentoring and other development opportunities, with 36.1% of men accessing development opportunities. That's up 9.6 percentage points since 2023, compared to only 27.5% of women, also up, but only 7.2 percentage points since 23. The second is the experience of gender diverse employees. Only 12.6% reported access to development opportunities. That's up less than 1 percentage point since 2023. 56% of gender diverse employees reported barriers to career advancement, more than twice the rate reported by men. This figure rose by 4.7 percentage points since 2021, while reported barriers declined for men. They held steady for women. So the headline story is positive, but beneath that headline, there are still structural barriers that organisations need to address. Next slide, please. So how can employers improve things in this area? Well, recruitment strategy should respond to an organisation's current composition. Women-concentrated organisations need to focus on attracting and retaining more men, and men-concentrated organisations on attracting and retaining more women. Organisations should ensure that recruitment doesn't reinforce existing segregation by disproportionately appointing one gender into senior or traditionally gendered roles. Reviewing job ads, role requirements and recruitment processes can help identify and remove unintended barriers. Duty holders should assess whether the gender composition at each level of the organisation reflects the level immediately below it, and identify where women or men are disproportionately dropping out of progression pathways. Because gender diverse employees may represent a small proportion of the workforce, their experiences can be masked in organisational level data. So I do expect duty holders to analyse this data carefully, engage directly with gender diverse employees where appropriate, and take deliberate action to identify and remove barriers to career progression. Progression pathways should be inclusive for all employees of all genders. Next slide, please. So leave and flexible working arrangements. One of the biggest drivers of workplace gender inequality is who undertakes unpaid care. Research shows that when fathers are actively involved in caregiving, children benefit socially, emotionally and cognitively. Mothers are better able to participate in paid work, relationships improve and families are generally better off. Flexible work and parental leave make this possible. They help people balance paid work with caring responsibilities. But despite these supports, women still undertake a very disproportionate share of unpaid care. Next slide, please. That's why increasing men's uptake of flexible work and parental leave remains one of the clearest indicators of progress towards gender equality. There are genuine signs of progress in our data. Men's parental leave increased across 6 of our 11 industries. The strongest improvement occurred in community and cultural services, where men's average parental leave increased by more than 4 weeks. Strong gains were also seen in universities and water and land management, and men's uptake of flexible work also increased more than women's between 2021 and 25. Nearly 1 in 5 men now work flexibly. We also saw increases in both women and men accessing carers leave. These trends matter because sustainable gender equality depends on men participating more equally in unpaid care. And this is one of the clearest examples in the report of why culture matters just as much as policy. The next slide, please. However, overall, the picture's more complex. So although men are taking more parental leave in most industries, men's parental leave duration declined across the sector as a whole, from 7.4 weeks to 5.7 weeks in 2025. And women's leave increased slightly. Importantly, this happened despite stronger parental leave entitlements being introduced in many workplaces. The sector level fall in men's uptake of parental leave is heavily shaped by large declines in 2 industries: in public healthcare, which was down 7.9 weeks, and police and emergency services down 6.2 weeks from 2023. Because these are some of the largest industries in the sector, a change in those industries can move the whole of sector figures substantially. And so that's part of the reason why we got a lower performance overall at the whole of sector level. Next slide, please. So we can't rely on solely on supporting women to participate more equally in paid work. It requires the other side of the equation, where workplaces where men are expected, supported, and encouraged to take a greater share of unpaid care. As a sector, we need to continue focusing on increasing men's uptake and duration of parental leave, while building workplace cultures that genuinely families support flexible work for people of all genders and at all levels. Parental leave, carers leave, and flexible work should never become barriers to career progression, leadership opportunities, or professional development. Finally, flexibility needs to be available across the whole workforce, including frontline and operational roles where traditional work from home models might not be possible. Innovation in flexible hours, job sharing, and other approaches are critical. Next slide, please. So the last indicator, gendered segregation. This remains one of the biggest structural drivers of workplace gender inequality. It shapes who does particular kinds of work, who progresses into leadership, and ultimately who has access to higher paid occupations. Unlike some of the other indicators we've discussed today, this challenge begins well before people enter the workforce. Gender norms influence education, training, and career choices from a very early age. Next slide, please. The encouraging news is that women's representation increased in several occupations that have traditionally been men concentrated. As I've already said, the strongest growth occurred among machinery operators and drivers, followed by technicians and trades workers. Women's representation in management also continued to increase, and transport became less men concentrated. Next slide, please. While there are encouraging signs of progress, the overall picture's only changed very slightly. So 7 of the 8 occupational groups remain gender concentrated in 2025, and most industries also remained either women concentrated or men concentrated. Next slide, please. Reducing occupational segregation requires sustained and deliberate action. Many of the strongest drivers sit beyond any one employer in our education system, occupational pipelines, and broader social norms. But organisations are not powerless. You need to examine how you recruit, develop, promote, and retain people across the workforce. That means building pathways into non-traditional careers, reviewing unnecessary barriers in recruitment, creating opportunities to develop skills on the job, and ensuring recruitment and communications reflect the diversity of the workforce that we want to build. For many organisations, particularly smaller employers, collaboration will be critical. Working with schools, with TAFEs, with universities, with industry bodies and other employers can strengthen talent pipelines and encourage people into careers they may never have previously considered. Occupational segregation will not change overnight, but every organisation does have influence over who feels welcome and safe, who's supported to succeed, and ultimately who chooses to build a career in their workplace. So that's the end of our slides. Thank you very much. So now I'll talk about what's next for the Act and the Commission. Since the Act was introduced, I've made it a priority to visit public sector workplaces right across Victoria. During COVID lockdowns, those visits were mostly online, but since then, I've actually visited 219 duty holders under the Act in person, the majority of those in regional and rural Victoria, right to the furthest borders, meeting directly with staff, with leadership teams and with boards. Those conversations have given me and my team a much deeper understanding of the different contexts and the complexities that public sector organisations navigate every day. My team and I are currently assessing the compliance of 300 progress reports and 300 new 4-year gender equality action plans from duty holders. These reports and plans show what's been achieved by organisations across the state and the strategies they'll implement over the next 4 years to strengthen gender equality. Progress in the public sector can improve outcomes for 500,000 employees directly, while setting a powerful example for the broader Victorian workforce. Public sector organisations must continue to embed gender equality as business as usual, integrated into processes and ways of working with responsibility and accountability led by senior leaders. This must be treated like any other legal responsibility, with KPIs built into senior leaders' performance plans, sufficient resourcing and genuine prioritisation of the work, and oversight by the organisation's governing body. In the next reporting period, I expect stronger targeted action on gender pay gaps. I expect urgent action to drive down sexual harassment and to improve formal reporting. And I expect a greater increase in men's uptake and duration of parental leave, with duty holders building workplace cultures that genuinely support flexible work and leave taking for people of all genders and, as I said, at all levels. This is the standard the Act sets and the standard the evidence tells us that Victorians need. Through this work, we'll build safer, fairer workplaces and deliver better programs and services for the communities that we serve. Thank you very much. I'll now hand back to Bryony for questions.
Thanks so much, Niki, and for painting the picture of 5 years of data where progress and persistence is. There's been some excellent chat and questions in this session. So it will be our Commissioner, Dr. Niki Vincent, answering these questions along with Dr. Kate Farhall, who is the manager of our Policy, Evidence and Regulation team. So let's just have a look at the first question. So Melanie asked, this is the first mention of the plus or minus 3% target range for pay gaps I have heard. Does this relate to a commission target across all defined entities or by organisation pay gaps? WGEA nominates a plus or minus 5% target range. So also interested in how 3% was determined.
Yes, absolutely. Well, I actually am going to hand to Kate for that because she works with Associate Professor Leonora Riz on building out all of this work. And so over to you, Kate.
Thanks, Niki. So we worked with Dr. Rees to develop a range of sort of progress ratings and sort of ideal gender equality states that we might be trying to move towards in terms of intersectional gender equality in the workplace. When we were looking at pay gap targets, we did definitely look at WGEA's plus or minus 5%, and we have used that in some of our previous publications as well. But this time around, we decided to go for a slightly more ambitious small gap range. And this tighter target, I guess, reflects the role of the public sector as a leader in the Victorian community. So by kind of holding the public sector to a higher standard, we can sort of lead the way in gender equality in the workplace and try to drive that broader change across Victoria. Also, because the public sector does generally tend to do better than the private sector in terms of pay gaps, we're sort of starting from a better spot. So I think we can be a bit more ambitious in that way. But noting that different industries and different organisations have quite different conditions that drive gender pay gaps and different kind of underlying gender inequality issues within their organisation or that sit across the industry as a whole. And so they'll be coming from really different bases. As Niki spoke about in the presentation, you know, local government's doing really well. It's sitting within that plus minus 3% range, but healthcare has a much larger pay gap at 29%. So Niki wouldn't expect healthcare to get to 3% overnight, but that's sort of the goal range that we're going for. And the plus minus just allows for some fluctuation where you know, probably not going to be sitting on 0 100% of the time. So just a small range to account for those kinds of fluctuations in pay, turnover of staff and that kind of thing as well.
We've got lots more information about all of that work in the actual report.
Thank you for that. We've got another question from Elaine. So this is the first time we've seen the 45-10 for gender composition from the Commission. Given many of us have used the 40-40-20 for our current Jeeps, how does this impact?
I'll let you continue because you were talking about that just now, Kate. So that's another extension of the question before.
Yeah, thanks, Niki. Yeah, a very similar answer to that in that we know the 40-40-20 is quite a common, target range for gender composition in workplaces. And so we did kind of look at that as a starting point. But again, the 45-45-10 was just about having a slightly more ambitious goal and trying to get closer to that balance across genders. It does allow still for some flexibility. So for those not familiar, the 45-45-10 means you're going for sort of 45% women, 45% men, and 10% can be people of any gender, which allows for, of course, gender diverse folks to be part of the workforce, but also, again, just those kind of natural fluctuations in workforce composition. So it's sort of saying not more than 55% of a single gender. Once you get past that, you're getting sort of more into a gender concentrated realm. But again, different organisations and different industries will look really, really different. And we know, for example, in our data, organisations such as rural healthcare is hugely women concentrated. That can be up around 80 or 90% women. So not expecting those organisations to suddenly completely change the gender composition of their workforce, but just that 45-45-10 is kind of a broader goal. And in terms of how it might relate to your current gender equality action plans, if you have a 40-40-20 goal within those plans, that's not a massive problem. We're not going to be reading your Jeeps and saying, oh no, we've got a tighter goal here at the Commission and you haven't aligned to that. So I think, having targets, having sort of measurable goals that you're shooting for within your gender equality action plan is really great. It can hold your organisation accountable. It can drive change. So having a 40-40-20 goal is a really, really good thing. So nothing to be alarmed about there.
Thank you, Kate. And we've got some questions streaming through. So we're just going to try and get through as many as we can in the next 15 minutes, but apologies if we do not get to your question as well. So we've got another question from Lucy, and this one's on sexual harassment. Since reporting captures sexual harassment experienced by employees, irrespective of who the perpetrator is, it is important to recognise that in healthcare, a significant proportion of reported incidences may be perpetrated by patients or members of the broader population. How does the Commission distinguish between sexual harassment as a workforce issue and incidences arising from interactions with patients or others who may be subjected to or aware of our workplace policies?
Well, we absolutely do know that that's a problem. Obviously, we get that broken down in our data. We can see that, and it's very similar with police and emergency services. But it's a work health and safety issue, and you would handle that in the way that you handle any other work health safety issue in your workforce. So, you have, when I go into health services, I see posters about behaviour, and we don't accept violence. We don't accept aggression towards our staff members. We also don't accept sexual harassment towards our staff members, regardless of whether you're a member of the public, a patient, or a fellow employee. Because it's hard doesn't mean we just throw our hands up and say we can't do anything about this. We absolutely have to protect the people in our workforce, the employees in our workforce, from sexual harassment, because it is a work health and safety issue just like any other. We do, however, understand how difficult that is. It's not a simple problem as just dealing with it between employees, although that is a significant problem in and of itself. But you have to have strategies to address it from patients and members of their families and members of the public, just as you would any other work health and safety issue.
Thanks, Niki. And I've got a question from Eugenio. Parental leave for secondary carers, horrible term, in healthcare EBAs compared to the VPS is significantly lacking. Will the Commission advocate about this?
We can certainly do what we can if you let us know. I mean, we're not familiar with every single EBA, but if there are particular areas where you feel that we could have an influence, we can certainly have a look at that and see where we can push for things. I'm quite a regular letter writer to various people of influence, so I'm more than happy to advocate where appropriate. So do let us know if you feel there's things that we can help with there.
I've got another question from Adele. Is there an argument for adjusting the cycle for reporting and developing GEAPS, Gender Equality Action Plans, so that we could have used these insights to inform our action plans?
We have adjusted the cycle. If you take a look at the legislation itself, it's actually quite different from the way that we have the cycle going now, where originally it was all data and your first gender equality action plans are due on the 31st of October, and then progress reports due on the 31st of October 2 years later, both data and reports. We did extensive consultation with duty holders because that was found to be really difficult for duty holders to actually manage all of the obligations all at once. So the way that we have structured things now is actually a response to our duty holders and what they advocated to us to change. So whilst we're not saying no to continually looking at this, I'm absolutely happy to hear from people who'd like things to change. The change that we made was in response to extensive consultation with duty holders.
I've got a question from Melanie. I would like to know recommendations on how organisations in female-dominated industries where women make up most of the workforce at all levels, including leadership, and there is a positive gender pay gap in favour of women, are expected to meet gender equality indicators.
What is the problem with meeting those indicators? That I think you're probably saying, how do we get more men into the workforce? Is that the suggestion? Yeah, you can't answer that because you've written the question. There are some in the full report. We've got some suggestions there about what you might do. We absolutely, as I've said in this talk, recognise that changing that gendered segregation in the workforce is not something that can happen overnight. We absolutely appreciate that, but we do want to see some of that, what the low-hanging fruit happening, some effort, in fact, to try and influence change in that area, in all of those areas. So perhaps have a look at the report and what we suggest in there for some ideas. As long as we see attempts at progress, you will meet compliance. It's when we get reports, as we quite often do, as I said, oh, well, we've already achieved this because we are overrepresented by women and we've got a positive pay gap in favour of women, job done. That's not the case. The Gender Equality Act is gender. People of all genders. So it's not just about women, and having a positive pay gap in favour of women isn't gender equality. So we've got to try and address those things as well.
Thanks, Niki. I've got a question from Katie. With the current resourcing pressures and organisational changes following the Silver Review, we're seeing gender equality work compete with increasingly stretched capacity and in some areas a lack of consistent executive sponsorship. Do you have advice on how we can continue to make meaningful progress and ensure gender equality remains an organisational priority when we don't necessarily have the resources or leadership attention we previously had?
Yeah, I absolutely get the dilemma. And it's something I talk to leaders about every time I meet with them because it's an issue that we hear constantly. Well, some of this is absolutely non-negotiable. So talking about sexual harassment, a work health and safety issue, it doesn't matter what size your organisation is, and doesn't matter how small your resources are, you have to protect your workers from sexual harassment. So non-negotiable. Those resources, however small, have to be put to protecting your workers. And then on the other things, well, that's partly our job to monitor and make sure that progress is made, that we see that resources are being put towards it. That's what our compliance assessment does. And if organisations, leaders haven't put enough resources towards gender equality, they won't be making progress and they'll get non-compliance. So I think ultimately that's where we'll end up, and leaders have to be held to account for that. The legislation allows you to give us reasons why you haven't made progress, and some of that can be other priorities. Not that doesn't apply in terms of sexual harassment, I would have to say, and workforce resources and so forth. And all of that is taken into consideration. But ultimately, the Act says that the resources must be applied to implement the Gender Equality Action Plan successfully. That's a requirement in the legislation. We've now got heads of organisations signing off on that to say, yes, I've read the plan, I endorse the plan, and I will commit the resources to that. Ultimately, if they don't make enough progress because they haven't committed enough resources, they'll end up with non-compliance.
Thanks, Niki. We've got 4 more minutes, so we've probably got enough for 2 more questions. I've got a question here from Belinda. Are there plans to develop industry-specific insight reports, not only at the public sector level?
You mean the whole of the public sector level? I'm assuming. Yep. Yes, there are. And we've got a very small team, as probably many of you know. So this has been a big undertaking to get this out. Once we've finished the compliance assessment process, which is the other big process that we're undertaking at the moment, we will concentrate resources on some sector specific industry level insights, particularly at public health. And police and emergency services are the 2 that I'm most interested in, but we will potentially do some others as well, and we'll publish those as we produce them.
Thanks, Niki. And I reckon this will be our last question, and it's from Marie. Regarding gender segregated workforce, given how entrenched gender segregation is within nursing and midwifery workforce, shifting the dial is challenging. Is there opportunity to develop a sector-wide Victorian approach to attracting and recruiting and supporting men into nursing and midwifery, alongside individual strategies implemented by public health organisations and universities? A coordinated sector-wide approach could enable shared messaging initiatives and resources and support greater collective impact in addressing gender segregation across the sector.
I think that's an absolutely fantastic idea, and I would very much endorse that. So I think, yes, that is absolutely the sort of thing that needs to happen to actually make progress in this area.
Yes, definitely not an easy one to shift, and I think this is also where communities of practices are so important as well.
Yeah, totally. Yeah.
That actually...
One more question?
We can do one more. Yep. Okay, I've got, so I have a question from Shannon. Will there be consequences for low GIAs or no progress? Leadership often looks at this as tokenistic without a push that is meaningful to them.
Yeah, absolutely.
Yeah.
Yeah. Absolutely. I've made it public that I will be taking action using the compliance powers this time around, because organisations have now had plenty of time to understand what they need to do and to get action happening. So where I need to take certain steps, initially talking to leaders about non-compliance, issuing warning notices, show cause notices, potentially issuing compliance notices. If I still don't get what we need in terms of progress, I can take further action, naming and shaming organisations, talking to the relevant minister, and if all else fails, I can take an organisation to VCAT and get an order directing them to comply with the legislation. So all of those tools are available to me, and this time we will start to use some of them. Last time we sent out compliance notices to board chairs. We didn't have those records of board chairs, so we hunted them all down and sent them out, and we got a big response from board chairs, and I think more attention. This time we'll be doing exactly the same, but as I say, where we've had repeated non-compliance, where an organisation is large and has a significant impact in the community, we will be starting to take compliance action.
Thanks, Niki. And we are bang on 12 now. So thank you everyone for joining us. This is a big week for us launching this report, 5 years of data. We would have posted the link in the chat, but we would have sent you an email this week with the link. We'll be sharing the recording and the slides from this event. So thank you so much for coming, and have a wonderful day.